My name is McClone. I'm a partner here at Orthopaedic Associates of St. Augustine. My specialty is sports medicine.
My name is Slappey, and I am a loss control consultant for a workers' comp insurance carrier. I sustained my injury to my left shoulder while I was working out.
With Melissa, she is active in CrossFit. There's a lot of stress on the rotator cuff.
When I met Dr. McClone, he explained that I had a very small tear in my infraspinatus in my rotator cuff, and he didn't think that I was a surgical candidate.
And she opted to go with regenerative medicine, and we chose PRP to put back in to see if we could heal it up. Well, there's really only 4 treatments in orthopedics and sports medicine. You have immobilization, you have physical therapy, you have injection therapy, and you have surgery. If it's a pain issue, such as the case in tennis elbow, a lot of times rotator cuff tendonitis, we'll try to use an injection to put the most potent anti-inflammatory exactly where it needs to be, and then we'll use rehab to correct the mistakes that you're making so that this doesn't continue to reoccur.
My name is Rick Crete, and I am a chain account manager for a distribution center in St. Augustine. So the pain in my left heel was bothering me for about 2 years. I met with Dr. McClone, and he diagnosed me with plantar fasciitis.
In Mr. Crete's case, he had had several injections, and he had tried physical therapy, and on MRI it showed that he did have a focal piece of scar tissue within his plantar fascia, which is very similar to a tendon. And so we used the TENEX system and did the FAST procedure. It's a technique that we would use when people have failed what we consider conservative measures, which are corticosteroid injections, anti-inflammatories, and physical therapy.
It went very smooth. I was actually pleasantly surprised. Not only met my expectations, but exceeded them.
Dr. McClone made me feel very comfortable. He explained my options very thoroughly.
Melissa had great results. She was able to return to her sport within 6 weeks, which is highly competitive. She's doing great and continues to do well.
So 3 months later, my foot is fine today. I'm actually back at the gym now.
I became interested in medicine at a very young age. It's what I've always wanted to do. I became interested in sports medicine when I was in residency at Mayo Clinic in Rochester.
My experience with Orthopaedic Associates of St. Augustine has been wonderful.
We take care of athletes of all ages here, from the youth soccer players and lacrosse players to our geriatric population. We do lots of golf medicine. The most satisfying aspect of my job is taking care of patients. I look forward to coming in every day and helping people. I always say that in ortho and sports medicine, people limp in and they walk out.